can you tell us a bit about the most common types of treatment that are available to people with a lung cancer diagnosis?
So treatment for lung cancer is, first of all, very varied. It depends on the type of lung cancer and probably most importantly on the stage of lung cancer. So it's important to realize that tumors which are at an early stage and haven't spread outside the lung, the majority of those will be treated by an operation as the principal treatment. Other treatments may be given usually afterwards, but an operation to remove it. And quite often nowadays, in fact, the trend is very much moving towards having keyhole surgery to remove the tumor and the lymph glands, which is much more tolerable and associated with less in the way of side effects and quicker recovery. Has been a major advance in the treatment of early stage lung cancer. There are people who have tumors that are in early stage, but because of their other health conditions, an operation, even a keyhole operation, may be too difficult for them or too risky for them. And for people who either don't want to have an operation, or for people who are just not fit enough to have an operation, other treatments may be available. And I'm thinking of radiotherapy, which is targeting the tumor with high energy X-rays to try and eradicate it completely. And there have been in recent years very significant advances in the treatment of lung cancer with radiotherapy, something that we call stereotactic radiotherapy, which aims to treat the tumor at a very high dose of radiation in a very small area whilst avoiding the other areas of the lung or other structures in the chest that could be damaged by the radiation. Moving on to sort of middle ground where tumors may be not spread to other parts of the body, what we call stage 3 or locally advanced tumors. And some of these may be operable together with other treatments such as chemotherapy, but some of them may not be easy to operate and remove. And the treatments for that can include a combination of chemotherapy, which is drug treatment usually given intravenously every few weeks, together with radiotherapy, which is X-ray treatment given every day over a number of weeks. And there are a number of different combinations of how we can do that and what's the best way of doing that. And recently, research has shown that adding in another type of cancer treatment called immunotherapy may be beneficial in treating those people after chemotherapy and radiotherapy. For people who've got advanced stage disease where the treatment has, where the tumor has spread to other parts of the body, there are a number of different treatments available, and they can include standard chemotherapy using drugs which kill the cancer cells and are given every few weeks. But there have been significant advances in the last few years in the treatment of advanced lung cancer, and new treatments such as targeted treatments, which are aimed specifically at any particular mutation in the tumor, can be given as an alternative to chemotherapy, or immunotherapy can be given. Now, immunotherapy can be given on its own or in combination with chemotherapy, depending on the type of the tumor and the likelihood it might respond to immunotherapy. Immunotherapy works in a very different way from chemotherapy. What it does is that it allows the body's immune system to see the cancer as being a foreign body, if you like. So tumors have developed a way of hiding or switching off the body's immune system so that they can evade it. And immunotherapy is a drug treatment given intravenously every few weeks, which, if you like, unlocks that and allows the body's immune system to try and attack the cancer effectively and shrink it down. And that can be given, as I say, on its own or in conjunction with chemotherapy.
There's a whole range of different treatments depending on somebody's diagnosis, the type of cancer and the stage of the cancer. And that feels feels like a major step forward in terms of lung cancer. So presumably that reflects the fact that surgery can be useful, but it's not the whole picture for lung cancer.
Yes, and I think that in the last 20 years, so within this century, treatment for lung cancer has really become A, more widely available, and B, much more successful in either curing or controlling the cancer. And there are new developments happening all the time, and the rate of new developments is just increasing and increasing. So although it is a terrible disease, the number of things that we can do to try and help is increasing really quite rapidly. And not just, I think it's important to realize that it may be that you have one treatment, but then subsequently you may have another treatment or another treatment. And so there are a number of different lines of treatment that people can have as they go on with their lung cancer.
And one thing that you touched on earlier is about if somebody has other health conditions, might that impact what treatment they're offered and how well they will cope with that treatment?
Yes, I think it's one thing that we have to discuss with anyone who's being diagnosed with lung cancer is what treatment they would be well enough to have. Now, hopefully most people will be well enough to have some sort of treatment, but it is important to realize that any treatment has potential risks or side effects associated with it. And what we have to do is balance those risks or those side effects with the treatment itself. And so it's important that you ask your lung cancer team why you're having a treatment, or indeed why you can't have a treatment. And I think it's important that it's explained to you why that might be the case.
And another factor that might influence treatment, I understand, is the physical location of the tumour in the lung. Can you explain to us a bit about why that might impact what treatments would be effective?
So the location of the tumour in the lung might influence what treatment you can have. If, for instance, the tumour is pressing on or going into other structures in the chest, such as the windpipe or other structures like blood vessels, then, for instance, an operation to remove that might not be possible because taking that out would be too risky or unsafe. And therefore another treatment such as radiotherapy and chemotherapy combined can be used. So the location is important, although there isn't any location which means that you just can't have any treatment at all. Mm-hmm. Unfortunately, lung cancer can be diagnosed when it's spread, and the spread is the thing that diagnoses the lung cancer. So if it's spread to a bone and someone has pain or problems in a particular bone, and that's looked into, it may be that they find that the cause of that might be lung cancer, and obviously that almost by definition is that it has unfortunately spread. It doesn't mean that treatment is unavailable. It just means that we're dealing with a stage 4 tumor which has already spread, and other treatments that we've talked about in terms of chemotherapy, immunotherapy, targeted therapies are all treatments which might be appropriate in that particular circumstance.